Cities watched our wastewater for COVID during the pandemic. Now Denver plans to look there again for signs of another health emergency, fentanyl abuse. Here's Kelly Rinke with that.
Of all the places to find clues about health, officials have turned to wastewater. Denver wants to know what samples can tell us about drug abuse in the city after seeing a record number of overdose deaths last year.
And hopefully in the future to use this information to predict overdose increases in the city.
Denver's health department is still in the planning phase, and they're not ready to talk about it yet. So we went to other cities like San Francisco, who've already started testing wastewater for drugs.
They really help us understand the relative quantities of drugs that are being used in San Francisco, in our case, in a very timely way.
Dr. Jeffrey Hom with San Francisco's health department says their program began in November, and they got some of the first results in December.
It's supporting what we know about drug use from our medical examiners' data. So that's certainly namely that, that fentanyl is being used, cocaine and methamphetamine. I would say the other way in which these data can really be used is to identify the presence of a new drug that may be introduced or may be circulating.
San Fran is taking samples citywide. New Mexico took a different approach.
Focusing on schools allows us to get samples across the state from all communities.
Jonas Armstrong with New Mexico's Environment Department says they have results from 106 high schools. The samples collected include anyone who used the bathroom that day, so faculty, staff, and students.
63% of schools have tested positive for cocaine. 13% have tested positive for fentanyl.
Scientists use this tool to track infectious diseases like COVID. Now it's being used to fight another health emergency.
How can we use wastewater testing to address substance use?
New Mexico now has a dashboard to track which schools are testing positive for which drugs. Cocaine was detected in samples really across the state, rural and urban areas. Fentanyl was found primarily in Albuquerque, which is the state's largest city.
I mean, it makes sense that if they have these proven methods of kind of community surveillance, not tracking the people, but tracking the areas, that they wouldn't just be one and done with it.
Yeah, and they think it's a really great tool because it really allows them to access data population-wide. If they have surveys, that's kind of a limited population, so it gives them a sense of what are the trends, across the state instead of just a certain group of people.
It's really interesting. Kelly Rinke, thank you.